Hello, I'm Dr. Kuo Ann. I'm a radiation oncologist at Mount Elizabeth Novena Hospital. Proton therapy has been around for 50 years, so it's not exactly new. However, the machines have been very big in the past and very expensive. So in the last few years, just like your handphone getting smaller and cheaper, so proton therapy machines have been getting smaller and cheaper and better at the same time, so that it's being installed in more and more hospitals around the world. So where it differs from a regular radiotherapy using X-rays is that protons stop. So whereas X-rays are more like a laser light, it shines from the source through the tumor and carries on to infinity, coming out on the other side of the tumor and exiting the patient. So it causes damage on the way in as well as the way out. In contrast, proton therapy is more like playing basketball or billiards or golf, where there is a particle, which is the proton particle, and you shoot it in the correct direction at the correct speed, and it will land in the tumor and stop there, and nothing comes out on the other side. So we reduce radiation injury to the normal tissues on the way in and especially on the way out. So that's the main attraction to proton therapy. It effectively reduces the radiation exposure to the patient maybe by about a third. And that is expected to reduce side effects both in the short term as well as in the long run. Technically, proton therapy is just another form of radiation. So one could argue that almost any patient that's undergoing radiotherapy could also have proton therapy. However, the benefits, of course, vary between different patients. So some patients will expect to see more benefit than others, and those are the ones that you would want to spend the extra money because it's more expensive to treat on proton therapy. So in general, young patients, because a lot of the side effects are late, they manifest years later, such as with growth or hormone problems or radiation-induced malignancy. Secondly, tumors that are large. So a large tumor would expect to have more radiation injury because the radiation fields are larger. And so the side effects would be worse for a patient with a large tumor. That's where proton therapy would shine. So because we intrinsically, physically reduce the radiation exposure to the normal tissues, the side effects will be less. A third category would be when the tumor is located deep within a sensitive organ such as the liver. So if a patient had a large liver tumor, in the past, we were unable to safely deliver a large dose of X-ray radiation without also causing too much unacceptable liver injury. But with proton therapy, we are now able to give that same dose of radiation safely because enough of the liver is saved from high dose. Another potential benefit would be patients would be those where they have previous radiation. So if we give a second round of radiation, the injury to the tissues would exceed what is safe. So if you can give proton therapy, we might be able to reduce the radiation exposure to nearby tissues. Having said that, proton therapy for re-irradiation cases still has to be very carefully done, and not everyone is a candidate because if the tumor recurrence is located in a critical organ, you have to deliver the high dose to that tumor at the critical organ. And no matter what radiation technique you are using, including proton therapy, there would be a high dose to that organ and hence would still be risky and dangerous. Mount Elizabeth always invests in the highest and the most advanced quality equipment. And so we have a wide variety of machines that enable us to deliver the best appropriate treatment for that particular cancer. So for instance, we were the first in Singapore to install a variant TrueBeam machine, which is a high-end radiotherapy machine that is very accurate and able to deliver quick treatments. We also are the only center in Singapore to have a gamma knife radiosurgery machine, which is a highly specialized treatment for brain tumors. We have a newly installed hyperthermia machine. I think we're probably one of the few in Asia where this is a way to increase the radiation killing of cancer without increasing the side effects to normal tissues. That likely to be operational in the next few weeks. And then finally we have the Proton Therapy Center. This is newest state-of-the-art compact proton radiotherapy machine, and it will be installed at Mount Elizabeth Novena Hospital. And so the cases that will be allowed to treat actually will be dictated by and guided by the Singapore Ministry of Health rules, which are actually online. So we are quite excited to be able to firstly have tools at our disposal. Previously with the highest end radiotherapy, X-ray radiotherapy machines, and now a newest edition of a proton therapy machine.